Hi, welcome back to the new episode of the Home Care USA Updates podcast. I'm your host, Bliss Brown, and I'm so excited for the second episode in our educational series this week. So this week we are talking about home care, home health, and hospice, and all the things that fall under each one. Now, some of you may be saying, I know what these are. A lot of you work in the industry, and that's okay. But today, we're mainly going to talk about how to describe these type of services to a legislator so you can be prepared for your next advocacy activity. So let's jump right in. So today we're going to start with just a big picture. So our last episode, we discussed the difference between Medicare and Medicaid, which a lot of the things we discussed on that episode kind of morph into this one as well. So if you haven't seen that episode, please come back and go back and watch that one and then jump back on here. I don't want you guys to miss anything because all of this information is so important. So let's start with a big picture. Often the easiest ways to understand all of the different services is to think about the reason someone needs care and answer some of these questions. So I wrote down 3 questions today just to kick us off. And the kind of header to that question is, are they trying to, 1, recover from an illness or injury? 2, are they trying to live safely at home with a long-term condition or disability? And the last one is, are they focusing on comfort and quality of life during a terminal illness? So the answer to all those questions often determines what type of service they need. So whether that falls under home health, home care, or hospice. All right, let's start with home care today. Home care is designed to help people live safely and independently in their homes over the long term. Unlike home health, which is often temporary, home care may continue for months, years, or even a lifetime. So for those that watched the last episode, you remember talking about Medicaid, Medicaid being more long-term, Medicare short-term. We're going to continue talking about it, but that's kind of a red flag, green light right there of kind of what services fall under which program, all that kind of stuff. They typically follow the same structure. So home care equals long-term. The goal is not necessarily to recover, while for some it may be to get better or to gain more strength. The goal is helping someone remain at home and avoid unnecessary institutional care. So that's the heart and soul of what us home care champions talk about. Just being able to stay out of an institution, be with your families. We harp on this every day, in and out. So that's important to remember. Depending on an individual's needs and the programs available in your specific state, because every state is very different when it comes to what programs fall under, what hat. They all have different names too. They make it really confusing for us. But just to list off a few, just to create some light bulbs in your head, home care can include services such as personal care services, private duty nursing, respite care, companion services, homemaker services, Medicaid waiver services, other home and community-based services. That is just an example. In your state, that all of those could be a completely different name. That's just something that I wrote down from all of the different areas that I've seen, but just an example of what falls under home care. So let's talk about an example of home care in the real world. For example, an older adult may need assistance with bathing, dressing, meal preparation, or mobility. That's one. Typically, that falls under personal care services in your state, whether it's named that or not. A child with complex medical needs may receive private duty nursing services through Medicaid. So that's a child that maybe they require intubation, feeding tubes, requiring a lot of high intensity medical care. Typically, you see that under private duty nursing. An adult with an intellectual or developmental disability may receive long-term supports through a waiver program. Again, that sentence could be spelled out very differently between each state, but the important thing to remember is someone, an adult or child with an intellectual or developmental disability could receive that long-term support. All of those examples fall under a broader umbrella of home care. The important thing to remember is that home care is focused on helping people live their lives in the setting they prefer, which for most individuals would be their home. All right, moving on to home health. Home care, home health. Sound the same, right? But there's a key difference here. So let's talk about it. Home health is skilled care provided under a physician's order to help someone recover from an illness, injury, surgery, or hospitalization. The key difference is that home health is generally temporary and goal oriented. So you hear that word goal oriented, they're looking for kind of that end result. They're looking to get that individual maybe back moving and walking again. Maybe they were in an accident and they are struggling to gain back their strength, looking for that PT, all of those different things. There's usually a specific reason the service was ordered and a specific outcome the care team is working towards, just like we said. So just like the last time, I'm going to give you guys a list of examples. Again, all of this can sound different where you're from. I don't want you guys to think that you could go to a legislator and maybe this is the exact same wording, but this is just generalized because there's a lot of you from a lot of different areas. So I don't ever want to send you guys in without the right materials. So if you ever have a question when we get to the end of this episode, hey, what is this called? The services for bathing and dressing. What is that called in North Carolina? Then you are welcome to reach out to us and we can help you personally on ensuring you know what to say. But to get into it, here are some common home health services: skilled nursing visits, physical therapy, occupational therapy, speech therapy, wound care, disease management, and education. Those are all just short list of examples. Again, plenty more we could talk about. So let's jump into kind of an example of an everyday home health patient. So someone has a knee replacement surgery. Their doctor orders physical therapy, the nurse visits to support recovery. Once the patient reaches their goal and no longer requires those skilled nursing services, home health care ends there. And again, a common thing is this is normally provided through Medicare. You give and take a little bit, but usually falls under that umbrella. So another example might be someone discharged from the hospital after pneumonia who needs monitoring and support during recovery. That's home health. You know, we hear those stories all the time. A lot of individuals don't even realize at some point in their life you're going to touch this. You may need some of that physical therapy, especially as you're getting older. You know, things like that happen. So it's important to know that that's something readily available. And if you're someone watching that's just interested in knowing what kind of things are out there that you can receive and you want to stay educated just in case you ever find yourself in that situation, I hope this is helpful. This is just something to keep in the back of your mind as a resource to know, hey, if I'm ever in that situation, make sure to ask your doctor about home health and what that can do for you. Many people associate home health with Medicare because Medicare is often the payer for these short-term skilled nursing services. However, there is a however to this one, home health isn't defined by who pays for it. Key, underline, not defined by that. It's defined by its purpose, helping someone recover and improve after a medical event. So I think the biggest thing for this section is to remember there's a goal at the end of the day. And that's not saying that there can't be goals at the end of the day for someone receiving home care. A lot of times, you know, I've had relatives that received home care that had an intellectual disability and they had goals for every week that they wanted to do and wanted to get better at and wanted to accomplish. So when I'm saying that, I want you guys to know I'm only using goal as, you know, ending of service. That means that home health is not coming to the home anymore. They've reached that certain point where home care, they reach goals every single day, but they're still there to support. Now moving on to hospice care. Hospice is specialized care for individuals facing a terminal illness. The focus shifts away from curing the illness and towards maximizing comfort, dignity, and quality of life. Biggest thing there is quality of life. With someone with a terminal illness, we want to ensure that they are having the best moments, you know, with their family, they're at home, they're able to close out their life in the way that they want to and with the people they want to. So just like the other segments, I'm going to list out kind of what falls under hospice and what type of services someone may receive while in that care. Pain management is at the top of the list. Symptom management, nursing care, social work support for the patient and the family, spiritual support, and bereavement services also for the family. One of the biggest misconceptions about hospice is that it means giving up. don't want you to think that. In reality, hospice is about ensuring that someone receives the support they need to live as comfortably and as meaningfully as possible. It's also important to remember that hospice supports the entire family, not just patients. And, I usually don't get into my personal stories because I've heard so many personal stories from so many people, but I've had up to 5 members of my family receive hospice care. And I've lost individuals in my family before we knew about hospice care, before I was in this industry. And that is just the one thing that the difference between those two experiences. The family members that I had, they were able to stay at home. They were able to be with us until the very end. And then the services that we received afterwards, after they had passed on, was just something so special. And it's important that I want you guys to know about hospice just as much as anything else that we talk about, just because it is just something that is so special and near and dear to my heart. So again, if you guys have any questions about any of this, hospice, home care, home health, you want to know what specific services your state provides, please reach out to us. We would love to help you and help you be prepared to talk to a legislator, because I will say even professional lobbyists go over this constantly because these things change. States change names of things. They change what things fall under what program. So please don't feel scared to reach out. We would love to help you. This is helping me even doing this session, going back and relearning about everything. It helps you as you prepare to go advocate. So let's do just a simple comparison for all three. If someone asks, how do I know which services I need? Think about the goal. I talked about goals a lot. Home care, the goal is long-term support and independence. Home health, the goal is recovery, rehabilitation, or management of a medical condition. And finally, hospice, the goal is comfort, dignity, and quality of life during a terminal illness. 3 services, 1 setting, very, very different purposes, but all very important and so helpful to all the individuals that receive them. So let's connect back to the last episode, because we talked about so much last time. I want to ensure that you guys see the flow between these episodes and can keep up as we continue to go through, kind of dialing this closer and closer and putting that magnifying glass on all of these different services so you know what's going on. So last month we answered the question, who pays for care, Medicare or Medicaid? This month, we're answering what type of care are they paying for. In general, Medicare is commonly associated with home health and hospice services. Medicaid is often the primary payer for many long-term home care services, including personal care, private duty nursing, and home and community-based services. Of course, every state operates differently, and every individual's situation is unique. But understanding the difference between the payer and the service is one of the most important concepts a family can learn, and one of those things that I don't see a lot of materials for. I think, it can be hard as a family entering into this world, finding out what services you have availability to, how it works in your different states. Maybe you moved from a different state and want to keep up with, what's different here, what's the same. It can be just so complicated, and there needs to be more materials out there, but I'm hopeful that this is helping you. Because Medicare, Medicaid, home care, home health, and hospice are all pieces of the larger system, right? We know that. And we're going to be continuing to we're going to just continue dialing this list in. I just named off all the things we've talked about so far. We have a few more episodes coming up for you guys in the next few months. We're going to be doing 1 per month, so you guys can really have just a great list of knowledge. And these are going to be evergreen podcasts. You got to come back and listen to this anytime. If you're listening to it now and you've never found yourself in need of services or needing this knowledge, and you're just here to advocate, but then down the road you need to learn more about it, you're not finding those resources, this is a resource for you. So please feel free to come back anytime. So today we learned that home care, home health, and hospice may all take place in the home, but they serve very different needs. Home care provides long-term support, home health helps people recover, and hospice focuses on comfort and quality of life. Understanding those differences can help families ask better questions, find the right services, and navigate the healthcare system with more confidence. Thank you for joining me for another amazing episode. Next month, we will continue breaking down other healthcare topics that people hear about all the time. And I cannot wait to continue diving deeper and learning along with you guys. So thank you so much. I can't wait to see you next time. See you in July.